Now, the World Health Organization is blaming the alarming rates of maternal mental health disorders in Ghana on the lack of policies to protect such vulnerable groups. This comes on the heels of a study by the WHO, which indicates that about 50 to 57% of pregnant women and mothers in Ghana experience clinical depression during and after childbirth. 13% of this figure who experience severe depression end up committing suicide. Rejoice Semefakpesu has more in the following report.
About 10% of pregnant women and 13% of women who have just given birth experience some form of mental disorder, primarily due to depression. Some of these mothers are compelled to commit suicide in severe cases. According to the World Health Organization, about 50 to 57% of women in Ghana suffer from maternal mental health issues, with depression being the most common case. Lead consultant for the World Health Organization on Maternal Health Dissemination Project, Dr. Promise Sefoga, attributed the prevalence of the disorder due to a lack of screening and policy.
So when a woman is pregnant, her body produces a lot of hormones that help her to go through the stress of pregnancy. Two of them we call estrogen and progesterone. So these hormones help to stimulate what we call feel-good factors in the woman so that she's okay to cope with the stress of pregnancy. After delivery, when the placenta comes out, the estrogen and the progesterone levels drop. But it's the same time that new baby stresses come up. So the woman who is predisposed begins to suffer anxiety, what we call postpartum blues, what we call perinatal depression, where she feels low in energy, unhappy. And the most severe form is what we call postpartum psychosis. Some of them get so severely depressed that they commit suicide. Suicide is just a sign of severe depression. In the very severe cases of postpartum psychosis, the woman feels that there is something about to happen to my baby, which is more terrible than the baby dying. And as a result of that sensation, they kill the baby. Unfortunately, our health system does not have provisions for screening. So from what I've said, these disorders can happen to anybody. What is needed is for us to pick it up early or pick the warning signs. Then we do very little to avert major complications. And that is what is lacking. In Ghana, for now, we do not do routine screening for pregnant women. As we speak, we have reviewed all the maternal and child health related policies by the Ministry of Health and the Ghana Health Service, and including the Mental Health Act of 2012, there are no provisions for maternal mental health. There is none. And so we are emphasizing the call. Fortunately, the minister has accepted the call and said the ministry is going to take that up. So there is no policy, which is why the starting point is to have a national policy that mandates the inclusion of mental health coverage for all pregnant and postpartum mothers in order to optimize their well-being and that of their newborns and children.
Speaking at the ceremony in Accra, the Minister for Health, Kweku Ajiman-Menu, said the government considered the issues a serious one and is considering drafting a policy that will provide a safety net for mothers struggling with maternal depression.
Maternal mental health issues can have significant implications for maternal and child health outcomes. To address these challenges holistically and globally, the WHO member states adopted and committed to meeting global targets of the Comprehensive Mental Health Action Plan 2013 to 2030 for improved mental health services to the people. Through this initiative, the government of Ghana has made several efforts to ensure the provision of high-quality mental health services to the population. And some of these include the Mental Health Act 2012, Act 846, and the Mental Health Policy 2019, provide the policy and legal framework for deliberate actions within the landscape. I wish to assure you that the Minister of Health will provide the necessary leadership and direction to ensure the full implementation of the recommendations of this report. Strengthening mental health system and ensuring that women have access to the support and care they need during pregnancy and postpartum period is a collective effort that requires all levels of society to provide high-quality, sustainable maternal mental health services. This is achievable with the right political commitments, the right systems and structures, development partner support, and citizens' involvement.
In severe cases of maternal mental health, some women end the lives of their babies. The growth, physically and mentally, of very young infants is likely to be affected by the actions of mothers with mental disorders. Prolonged or severe mental illness hampers the mother-infant attachment, breastfeeding, and infant care. Rejoice Semefakbasu's report, read to you.